Welcome to our class. Uh, Again, we will recollect what we have discussed in last classes. Okay, what we are discussing the transport mechanisms of drug absorption through the GIT. So, what are the various transport mechanisms are available for drug absorption? Intracellular or transcellular mechanisms, paracellular or intercellular, and endocytosis, right? Or vesicular transport systems. So, in that, till now we discussed only about intracellular and transcellular transport. In that, again, we have read so many classifications. Okay, so you all remembered all those things, I think. So, there is a continuous reading is important to remember all those things. You have number of classifications under mechanism of the transport. In your exam point of view, they will ask the specified transports, so you must have awareness to write any of the mechanism. So you have to go through a separate reading of individual mechanisms which involved in absorption of drugs through the GIT. Okay, so next come to this paracellular or intercellular transport. So what do you mean by intercellular? The transport is occurring between the cells. Intermediate means what? The transport will occur between, in the medium, in the middle. So it is defined as the transport of the junction drugs through the junctions between the GI epithelial cells. Once again, I am reading. It is defined as the transport of drugs through the junctions between the GI epithelial cells. Here, the transport of drugs will occur in between the cells. How it will be? Through the tight junctions which are joining the adjacent epithelial cells. See here in this diagram, it is showing a clear picture where the tight junctions will be. See, in between, these are the epithelial cells. Okay, the tight junction is joining these gel cells to each other. See here. Okay. In the paracellular transport of drug is of two types: permeation through tight junction of epithelial cells or persorption. So what do you mean by permeation? So the diffusivity of the drug particles from the site of administration to the plasma, right? You may all know that main objective of our drug absorption. So in case of this permeation, the process basically occurs through the openings which are little bigger than the aqueous pores. In case of pore transport, there is a pores are present which are having small in size, as in when you compared with these tight junction openings. These tight junction openings are few more larger than pores which are present in pore transport, right? Compounds such as insulin and cardiac glycosides, which are used for treating CHF and all. CHF means what? Congestive heart failure. Compounds such as insulin and cardiac glycosides are taken up this mechanism. The permeation of drugs through tight junctions of epithelial cells is taken up by the compounds like insulin and cardiac glycosides for the effective drug absorption through the GIT. And then next one is persorption. It is permeation of drug through temporary openings, not a permanent openings. Those are temporarily opened for few time. For some times it will be opened and it will be closed. Okay, some drugs are entered through these persorption mechanisms. and how they formed temporary openings by shedding or entering of two neighboring epithelial cells into lumen. So when the two epithelial cells will be entered into the lumen, there may be a chance to form a temporary openings for drug absorption. This mechanism is called persorption. Paracellular or intercellular transport is happened in between the cells where the tight junctions are present. Okay, this mechanism is of two types: permeation through tight junctions of epithelial cells and persorption. The compounds like insulin and cardiac glycosides are taken up permeation through the tight junctions, and persorption where the temporary openings will be formed by adjacent epithelial cells when they are entered into the GI lumen. Okay, everyone is cleared about this? Right. Shall we move on to next one? That is the last one, vesicular or corpuscular transport. That is nothing but endocytosis. This is the last method of transport of drugs through GIT. It is the minor transport mechanism which involves engulfing, that is capturing extracellular materials within a segment of the cell membrane to form a vesicle. Hence, this is also called as vesicular transport or endocytosis. Okay. And the next one is vesicular transport of drugs can be classified into two categories. What are those? Phagocytosis and pinocytosis. These vesicular transport is of engulfing, that capturing the extracellular materials within a segment or a cell membrane to form a vesicle, that is a spherical shaped vesicle. Hence, this is also called as vesicular. Vesicle formation will be takes place now. For that reason, this type of transport will be called as vesicular transport. And vesicular transport of drugs can be classified into two categories. What are those? Phagocytosis and pinocytosis. Phagocytosis, cell eating; pinocytosis, cell drinking. Okay, in case of phagocytosis, cell eating will take place. How? Absorptive uptake of solid particulates. Okay, your solid particle will be eaten in case of phagocytosis process. Pinocytosis, just drinking. Cell drinking means definitely there is a presence of solute fluid, that is uptake of solute fluid. Drinking means that is in the material which used to take for drink, that should be present in liquid manner. So liquid state in the sense of our subject view, what is the liquid state? That is nothing but a fluid, that is absorption fluid. So cell drinking, that is nothing but pinocytosis. So your solid particles may get fluid drinking. So that is nothing but pinocytosis. Gastrointestinal lumen. See here in this picture, macromolecule is there. So when this macromolecule is in GI lumen, so when it enters into the membrane will be engulfing this macromolecule. Okay, then it leads to the formation of vesicle. Vesicle means vesicular systems are there. These are one more type of novel drug delivery system. The drug particle will be surrounded with a phospholipid membrane, that is nothing but vesicle. See here, one spherical shaped vesicle is surrounded by other membrane, that is nothing but GI membrane. Then when this vesicle is ready to enter into the blood, the GI membrane will be opened. See here, then it will be easily entered to the blood. So this is the mechanism of vesicular or corpuscular transport. So you have three mechanisms. I am repeating again. Transcellular, or also called as intracellular, intercellular or paracellular, then finally vesicular or corpuscular. Then these may be divided into different categories. You just go through that, you can read from that. Okay, then next come to the next point which is mentioned in your syllabus: Factors influencing the drug absorption and bioavailability. Generally, what are the factors going to influence your absorption of the drug? By proper biopharmaceutical design, the rate and extent, that is nothing but your bioavailability, will be varied from rapid, that is fast and complete, slow and sustained, depending upon the desired therapeutic effect. So which type of dosage forms will get desired pharmacotherapeutic effect, then only you may consider your bioavailability of your product. That is, the rate and extent of the drug absorption is nothing but a bioavailability. The sequence of events that occur following administration of solid dosage form until its absorption from to the systemic circulation. So what is the major process consisting of your absorption? 4 steps. First one be your drug will be disintegrated into smaller particles. Then it will be deaggregated. Aggregation means it forms a clump. Then it will be deaggregated. It should be available. It should be available for more absorption rate. Then it should get dissolved. Then finally it will goes to the absorption process. The rate at which drug reaches systemic circulation is determined by slowest of the various steps involved in sequence. Such a step is called rate determining or rate limiting step, where the drug absorption should be limiting, in which process either it may be a dissolution or a diffusion or whatever it is, it depending upon the type of the drug and type of the dosage form. So that is nothing but a rate limiting step or rate determining step. Okay, I hope you all are understood. Okay, if you have any doubts, ask me. You just write your running notes also. Next one is the, so when you come across this chart, you might have seen different types of uh, parameters. So we just go through this. GI lumen is there, GI barrier, and it is a blood, right? When here the number is also there, you just see there. When you take the solid dosage form, it will be split it into granules or aggregates. Then finally, it forms a fine particle. So your drug will be available for absorption in 3 terms. Either it may be a fine particles, or it may be a granules, or it may be a solid form. Right. Okay, these 3 different forms will be available for drug absorption site in the form of solution. So your drug may be either of non-ionic or ionic drug. If it is non-ionic drug, as it is, the drug will be entered into the blood or systemic circulation, or also called as plasma. And if your drug will be in ionic nature, it is directly entered into the blood. So this is the step 4. So what is the sequence of events of drug absorption from orally administered solid dosage form? Disintegration, deaggregation, dissolution. See here, disintegration, deaggregation, dissolution, absorption, final stage. Okay, so once again I am repeating you. Either you are what you are going to take, either it may be a solid dosage form or granules or fine particles, whatever it is, the drug should be available in solution at absorption site. Why? Because we need to achieve more absorption, then only we can achieve more oral bioavailability of particular orally administered drug. Is it clear for everyone? Okay, then move on to next. So till now what we discussed, mechanisms of drug transportation and what are the factors influencing the absorption and bioavailability. So then these are very important things. Okay, factors affecting absorption. You have 3 different kinds of factors which are going to affect your absorption rate. What are those? Majorly 3 types: pharmaceutical, physiological, and patient related. Pharmaceutical, physiological are also called as formulation and patient related. Pharmaceutical factors, formulation factors, And finally, patient-related factors. 3 types are there. First, let me discuss about pharmaceutical factors. And one more important thing, in that pharmaceutical factors or a formulation, in case of formulation factors, you have to keep it in mind all types of dosage forms which are present in our technology subject. So what are all types of dosage forms? What is the solution forms, syrups and biphasics, monophasics, external usage dosage products and internally administered dosage products. All those things you have to keep it in mind. And in case of pharmaceutical factors, the subject mainly focused on only the manufacturing of your tablets, solid forms. Okay, because this manufacturing of solid state product may face so many difficulties, because we are going to add more than 10 number of excipients to making a tablet or a capsule or whatever it is, the solid dosage form. So in the sense of they are keep it in mind of your solid dosage form, then they developed pharmaceutical factors which are affecting particularly for solid dosage forms and absorption site. So in that factors, first I would like to consider to discuss only pharmaceutical factors, okay, in this class. Physicochemical properties of the drug. The first factor which is in pharmaceutical factor is physicochemical properties of the drug, the chemistry and the physics. Physicochemical. So what are those? Drug solubility and dissolution rate. Write it down. Particle size and effective surface area, polymorphism and amorphism. Pseudopolymorphism. Pseudopolymorphism is nothing but hydrates or solvates, salt form of the drug. Lipophilicity of the drug, drug stability and stereochemical nature of the drug. These all are the factors, pharmaceutical factors which are affecting absorption, right? Okay, in that physicochemical properties of the drug, first factor is drug solubility and dissolution rate. Next one, particle size and effective surface area. And third one, polymorphism and amorphism. Fourth one, pseudopolymorphism or hydrates or solvates. Next, fifth one, salt form of the drug. Then lipophilicity of the drug, drug stability, and last one is stereochemical nature of the drug. These all factors are very, very, very important in case of your exam point of view. Okay, so first, these are the pharmaceutical factors, and formulation factors, patient related factors, we will discuss it in further classes, right? First we will discuss about pharmaceutical factors under physicochemical properties under the drug solubility and dissolution rate. I will discuss these factors in later. Okay, what is the drug solubility and dissolution rate and how it affects your absorption rate from the GIT? When you take the solid dosage form, see here ma, when you take the solid dosage form, first it would get disintegrated into solid drug particles, individual particles. First it should get disintegrate, then it should undergo dissolution. This is RDS is rate determining step for lipophilic drugs, right? Then after disintegrating into small particles, then your drug in solution at absorption site is available. Then it will goes into the body. So how the drug will be at absorption site to the drug in the body? Through the permeation mechanism. Here rate determining step for hydrophilic drugs. The permeation is rate determining for hydrophilic drugs. The dissolution is rate determining for hydrophobic drugs. That is nothing but lipophilic. Don't get confused. Hydrophobic or lipophilic are the same. Hydrophilic is different. Hydrophilic, water loving. So that's why they can enter from the site of administration into the body via permeation mechanism or through the permeation mechanism. Just remember it, ma. And here in case of poorly water soluble drugs, those are hydrophobic drugs, those are lipophilic drugs. See ma, poorly water soluble drugs or lipophilic drugs, or then tell me hydrophobic drugs. These are having rate determining step or rate limiting step is dissolution, right? Next one is SEMA. For hydrophobic drugs, dissolution is rate limiting step. Griseofulvin and spironolactone, these drugs are having very poor solubility, very poor oral solubility. So these comes under hydrophobic drugs. For lipophilic drugs, these are easily soluble in aqueous medium. So these can be entered into the plasma through permeation mechanism. So the permeation is a rate limiting step, right? What are the examples? Cromolyn sodium and neomycin, few of antibiotics, right? And next important one is, and how the mechanism of hydrophilic drugs and hydrophobic drugs. SEMA, hydrophilic drug from the this intestinal lumen, when it enters into the interstitial fluid through the capillary wall, through the paracellular route, the hydrophilic drugs is here. SEMA here. Transfer of from diffusion to the membrane, permeation, transfer through cytosol, permeation transfer to blood components, transcellular route. So here in case of hydrophilic drugs, these may follow paracellular route. In case of lipophilic drugs, these may follow transport mechanism. Which one is transcellular mechanism? So here this is basolateral membrane and this is apical membrane. These are present in the intestinal lumen. Once your hydrophilic drug will be enters into the lumen, it directly goes to the interstitial fluid through blood capillaries, through paracellular route. Okay, it enters into the plasma. And in case of your hydrophobic drug or lipophilic drug or it follows the mechanism of transportation, that is transcellular route. Okay, it enters to the permeation, then permeation transfer of your drug, then permeation of transfer into the blood components, then finally it reaches the plasma. So this graph is clearly showing that the mechanism of hydrophilic and hydrophobic drugs, how it enters into the plasma. And then the major important thing in case of your exam point of view, the theory of drug dissolution, these all should comes under first point of physicochemical properties, that is under drug solubility only. Theories of drug dissolution are there under drug solubility point. The factor under drug solubility factor which is influenced your GI absorption. So see here, this is the solid dosage form, that is tablet, and it is disintegrated and it is dissoluted. What is this structure? Stomach, SEMA, tablet, disintegrating, and it is dissoluted. So what are the theories of dissolution and how they influence your absorption of GIT? Okay. Introduction. Drug is a single chemical entity present in a medicine that used for diagnosis, prevention, treatment or cure of diseases. You may all know this. Next one is dissolution is a process in which a solid substance solubilizes in a given solvent. That is nothing but mass transfer of solid from surface to the liquid phase. From solid state to the liquid phase, the transfer of your drug particle is known as dissolution. Once again, I am repeating you. The solid is changes its states to the liquid in presence of solution. That is nothing but solution. That is nothing but dissolution. Drug dissolution mainly occurs in where? Stomach and intestine. Acidic pH conditions and alkaline pH conditions. Stomach maintains acidic pH conditions, that is 1 to 3. Intestine maintaining alkaline pH conditions, that is 5 to 7. So the drug dissolution might be occurs in stomach and intestine. SEMA. Acidic drugs are used and enteric coated tablets are used. Enteric coated tablets are released in the intestine only. So SEMA. This picture is clearly showing that this is a tablet. When it undergoes disintegration, it leads to the formation of granules. Then these granules should be reaggregated and leads to the formation of fine particles. So the availability of fine particles is more for drug dissolution. SEMA, clearly note down the point. Okay, the availability of fine particles will be more for dissolution. The granules will be intermediate and the dissolution of directly drug is very slow because the finest particles where it will be available after deaggregating your granules, the fine particles will be formed. So these fine particles will be available and these fine particles will be solubilized more rapidly than granules and tablets, right? So the availability of drug in solution will be in the form of fine particles only. So next one is, there are three major types of dissolutions are available. Okay, in that, diffusion layer model or film theory. Next one is Danckwerts model or penetration or surface renewal theory. And third one is interfacial barrier model or double barrier or limited solvation theory. These are the three types of many theories explained to drug dissolution. The important ones are diffusion layer model or film theory. Write it down. Diffusion layer model or film theory. Next, second one is Danckwerts model or penetration or surface renewal theory. And third one is interfacial barrier model or double barrier, are also called as limited solvation theory. Next, we will discuss about first one, diffusion layer model or film theory. The name itself indicates where the diffusion will take place after forming a film. Simplest and most common theory of dissolution. Seema clearly? This process of dissolution of solid particles in a liquid in absence of chemical forces. Okay, there is no chemical forces are required to conduct this process, but these are consisting of two consecutive steps. What are those? Solution of liquid to form a thin film or layer at the solid liquid interface known as stagnant film or diffusion layer. And after forming this stagnant layer or diffusion layer, this layer is saturated with the drug. The step is usually rapid. So you have to remember this. There is a formation of stagnant film or diffusion layer will be takes place where where solid liquid interface, at the solid liquid interface there is a formation of stagnant film or diffusion layer will takes place in diffusion layer model of film theory. Then this layer will be saturated with the drug. Then finally this step is usually rapid. Okay, see here ma, diffusion of, so this is the first step. What is that first step? Formation of a stagnant layer. What is the second step? Diffusion of the soluble solute from the stagnant layer to bulk of the solution. This step is slower, but the stagnant layer formation is more rapid. Then the diffusion of drugs from the stagnant layer is step slower. So the rate determining step in the drug dissolution. See here, solid particle is there and dissolving drug is there. Seema, this is the solid liquid interface, and where the stagnant diffusion layer will formed between the at the solid liquid interface. At the solid liquid interface there is a formation of stagnant layer. These are the molecules which are diffused. So these molecules will enter into the GI lumen, GI barrier and blood. So what is the important thing of in this diffusion layer model theory? First step, it is a formation of stagnant layer at solid liquid interface. This step is very fast or very rapid. And next important one, diffusion of the soluble solute from the stagnant layer to the bulk of the solution. Seema, here your drugs will be diffused at the stagnant layer. So then these will be diffused into the bulk of the solution. The step is slower. So that's why the step is slow. That's why the rate determining step is drug in dissolution. So this theory is controlled by Noyes-Whitney equation, that is dC by dt is equals to K into Cs minus Cb. S means what? Stagnant layer. Concentration of drug at stagnant layer and concentration of drug at bulk of the solution. Seema, S stands for stagnant layer, B stands for bulk of the solution. Concentration of drug at stagnant layer and concentration of drug at bulk of the solution. K is the constant. Which constant? Dissolution rate constant. dC by dt is dissolution rate of the drug. Okay, ma? And next one is Nernst and Werner incorporated fixed law first diffusion modifies this Noyes-Whitney equation. These are the two scientists, Noyes and Whitney. These can form one equation, and these equation can be modified by Nernst and Werner. So how they modified with respect to the surface area and partition coefficient and all. Sigma dC by dt is equals dAk W by O Cs minus Cb by V into H. D means diffusion coefficient of the drug. A is the surface area of the dissolving solid. Kw by O is the partition coefficient of in sigma, water in oil partition coefficient. S stands for stagnant layer, drug concentration at stagnant layer and drug concentration at bulk of the solution. And V is the volume of the dissolution medium, and H is the thickness of the thickness of the membrane, or also called as concentration gradient for diffusion of the drug, whatever it is. H is nothing but thickness, or also called as thickness of the membrane, or concentration gradient for drug diffusion of drug. Okay, so then this is about two equations. The Noyes-Whitney equation assumes that the surface area of the dissolving solid remains constant during the dissolution. During the dissolution process, the surface area which is useful for dissolving the solid will be constant as per Noyes-Whitney. To account for the particle size decrease and change in the surface area as per Higgs and Crowell. He is one more scientist. Okay, as per Noyes-Whitney, surface area will be constant unless it gets dissolved. But in case of Higgs and Crowell, the particle size will be decreased and change in surface area. Sigma WO 1 by 3 minus W 1 by 3 is equal to KT. WO is original mass or weight. Mass is nothing but the weight of the drug, and W is the mass of drug remaining to dissolve at time T, and K is the dissolution constant. Sigma WO is the original mass of the drug. So W0. 0 means what is initial. So original mass of the initially the drug is having its original mass or own mass, right? So that's why W0 is original mass or weight of the drug, and W is the mass of the drug remaining to dissolve itself, and K is the dissolution rate constant. And next, modify Noyes-Whitney equation represents first order kinetics, right? The driving force for which is the concentration gradient. Concentration gradient, how you develop the concentration at stagnant layer and the concentration of drug at bulk of the solution. This is the final equation. And to obtain good IVIVC, in vitro in vivo correlation, must be performed under sink conditions. That means the stagnant layer drug concentration will be more than the concentration of drug at bulk of the solution. At that circumstances, what will be your equation? dC by dt is equal directly constant. So this equation follows zero order kinetics. This represents the dissolution will be the dissolution rate will be constant under the sink condition. Sink condition means what? Suppose in case of dissolution of tablet, you are going to use 900 ml of fluid or aqueous medium for dissolving the drug. So at each interval, you need to withdraw 5 ml of your dissolved drug sample. And at the same time, you need to add same amount, same quantity, that is 5 ml of fresh buffer or fresh aqueous medium to the beaker from which you taken the sample. So every time you should maintain constant volume of that particular beaker which your drug will be going getting dissolving. So that is nothing but sink condition. So same constant level of fluid or volume which is required for dissolving of your drug will be maintained, right? Same volume, that is nothing but sink condition. And what about this zero order and first order? Only one thing I want to tell you now. and remaining things you have to learn it next classes. Okay, zero order means this is concentration, concentration independent, and first order kinetics are concentration dependent, dependent kinetics. Seema, this is the first order curve, the curved curve, and this straight line will be the zero order dissolution rate. When you plot the graph between plasma concentration versus time, you will get the graph like this. Okay, shall we stop our class now? In what we discussed in the class, you have various mechanisms of drug dissolution and how it happened, and what are the mechanisms. You have film theory or diffusion layer model theory, and remaining two theories we will continue in the next class. Okay, okay, then next we will meet it again.